Welcome to Medical Specialists Associates' educational series on topics in critical care medicine. I'm Christopher Voss, MD, MS, FCCP, board-certified in anesthesiology, critical care medicine, neurocritical care medicine, addiction medicine, and pain medicine. Alcohol withdrawal is a potentially life-threatening condition that requires prompt and effective treatment, particularly in inpatient settings. Traditionally, benzodiazepines have been the cornerstone of treatment. However, recent research has shown that ketamine, an NMDA receptor antagonist, may offer a beneficial role in managing alcohol withdrawal, especially in cases where conventional treatments may not be sufficient or are contraindicated. In this video, we will explore how and why ketamine is used for the treatment of acute alcohol withdrawal in hospitalized patients, focusing on its mechanism of action, clinical benefits, and current research. We'll also discuss how ketamine can be integrated into the broader management of alcohol withdrawal syndrome, AWS. Understanding alcohol withdrawal. Before we dive into the specifics of ketamine, it's important to understand the pathophysiology of alcohol withdrawal. Chronic alcohol use affects various neurotransmitter systems in the brain, especially gamma-aminobutyric acid, GABA, and glutamate. Alcohol enhances the inhibitory effects of GABA and reduces the excitatory effects of glutamate by acting on NMDA receptors. When alcohol intake is suddenly stopped, the GABAergic activity is diminished, and there is an unopposed surge in glutamate activity, leading to the excitotoxic state that characterizes alcohol withdrawal. Symptoms of alcohol withdrawal can range from mild tremors and agitation to severe complications such as seizures and delirium tremens, DTs, which can be life-threatening if not properly managed. The role of ketamine in alcohol withdrawal syndrome. Ketamine's primary mechanism of action is as an NMDA receptor antagonist. By blocking NMDA receptors, ketamine counteracts the heightened glutamate activity that occurs during alcohol withdrawal. This is particularly important in severe cases of AWS, where there is a risk of neurotoxicity due to excessive excitatory signaling. Ketamine has several important roles in AWS. As an NMDA antagonist, ketamine helps suppress the hyperactive glutamatergic system that contributes to the excitatory symptoms of withdrawal. Benzodiazepines remain first-line agents for alcohol withdrawal due to their ability to enhance GABAergic activity. However, when used alongside ketamine, the overall sedative effects can be enhanced, allowing for reduced doses of benzodiazepines and potentially mitigating side effects such as respiratory depression. Ketamine has analgesic properties, making it particularly useful in patients who are in pain during withdrawal. Additionally, its sedative properties can be beneficial in controlling agitation and hyperactivity. Some studies suggest that ketamine has neuroprotective properties by reducing excitotoxicity, which could be beneficial in preventing long-term neurocognitive damage during severe alcohol withdrawal. Beyond its role in managing acute withdrawal symptoms, ketamine has shown promise in addiction treatment, particularly in helping patients remain abstinent from alcohol. Ketamine's effects on the brain's neuroplasticity and its ability to disrupt maladaptive neural circuits associated with addiction may help in reducing cravings and preventing relapse. Preliminary studies have suggested that ketamine, when used as part of a comprehensive addiction treatment program, may enhance long-term abstinence rates by altering the brain's response to addictive substances. Clinical evidence and guidelines. Recent clinical studies have demonstrated promising results for ketamine in the management of AWS. Here's a brief overview of the research. Several studies have shown that ketamine can reduce the amount of benzodiazepines required in AWS. In a randomized controlled trial, ketamine significantly lowered benzodiazepine requirements in patients with severe withdrawal, thus decreasing the risk of respiratory depression and prolonged sedation. While ketamine is often used in conjunction with benzodiazepines, it has also been studied as a standalone treatment for alcohol withdrawal, particularly in patients who are refractory to traditional therapy. A case report demonstrated that ketamine infusion was able to control severe symptoms in a patient with benzodiazepine-refractory AWS. There is emerging evidence suggesting that ketamine might help prevent or reduce the severity of DTs, one of the most dangerous complications of alcohol withdrawal, though more research is needed in this area. How ketamine is administered for alcohol withdrawal. Ketamine is typically administered as a continuous intravenous infusion in the inpatient setting. The dosing protocols vary depending on the severity of withdrawal and the patient's response to treatment. But a common approach is to start with low-dose infusions and titrate based on clinical effect and sedation levels. Dosing protocols. Initial dosing often starts with a bolus of 0.1 to 0.3 milligrams per kilograms IV, followed by a continuous infusion at 0.1 to 0.3 milligrams per kilograms per hour. Adjustments are made based on symptom control and the patient's level of sedation. Intermittent dosing. In settings where continuous infusion is not available or feasible, intermittent dosing can be employed. This involves giving ketamine as a bolus dose of 0.2 to 0.5 milligrams per kilograms IV every 4 to 6 hours. This approach allows for regular reassessment of the patient's needs and minimizes the risks associated with continuous infusion, such as cumulative sedation. Continuous monitoring is essential, particularly for respiratory status and hemodynamics. Ketamine's dissociative properties also mean that patients need close neuropsychiatric monitoring to avoid emergent phenomena such as hallucinations. Safety and side effects of ketamine in AWS. While ketamine offers a novel approach to AWS, it is important to consider its side effects. Ketamine can cause dissociation, hallucinations, and, in some cases, delirium. These effects may be problematic in patients with severe alcohol withdrawal, so careful dosing and monitoring are critical. Ketamine can increase heart rate and blood pressure, which may be a concern in patients with cardiovascular comorbidities, though this is typically less problematic with lower sedative doses. Although ketamine has a low potential for abuse at therapeutic doses, it's important to be cautious in using it in patients with a history of substance use disorders. Future directions and conclusion. The use of ketamine in acute alcohol withdrawal is a rapidly evolving area of study. While it is not yet a first-line treatment, ketamine's unique mechanism of action and its ability to complement traditional therapies like benzodiazepines make it a valuable tool in certain clinical settings. Ongoing research is likely to clarify its role further and refine protocols for its use in AWS. To learn more about critical care medicine, please visit us on our website at www.medspecialists.net and subscribe to our YouTube channel.